Welcome back to the Island Docs. We just saw Michael who had triple bypass, and today we have a very special guest, Dr. Mohammed, who's about to tell us about heart attacks. Let's give Dr. Mohammed a round of applause.
Thank you.
So, Dr. Mohammed, heart attack is a very, very frightening thing for people in the Caribbean. Tell us a bit about it in your experience. How do people present with a heart attack? How was your experience?
Okay, so with heart attack, it's one of the most common killers in most sedentary, domesticated, a lot of societies. So with heart attacks, the way it works is your heart is under duress. And it's under duress because it's not getting enough blood supply. As it's not getting blood supply, it's the muscle of the heart starts to die, and you start having pain and chest pain and dysfunction of the heart. So before all that, some of the risk factors for heart attack is high blood pressure. If you have a persistent high blood pressure, you could damage the blood vessels inside your heart, which cause you to have high blood pressure. If you have high cholesterol, what happens with high cholesterol? It lines the inside of the blood vessels and it cuts off the supply of the blood vessels to the heart. If you have any other underlying congenital heart disease issues, it could give you heart attacks as well too. So with heart attack, the symptoms that generally people experience are the usual classical, I feel my chest pounding, my chest hurts, I feel like somebody's heavy or an elephant is sitting on my chest. They have pain that radiates to the neck or to the left side of their neck, to their shoulder, down their arm feel funny, they feel short of breath, they feel like they can't catch their breath, their heart is racing real fast. Those are the usual classical symptoms. However, we have to be careful. With women, it's a little bit different, and patients who are diabetic, it's a little bit different. Diabetes, which is another risk factor for heart attack, is with diabetic patients, their nerve sensations have been killed off. So they don't feel the same pain that they do who patient who doesn't have diabetes. Their pain will be a little more silent. They'll just feel a little pressure here. And they won't know until we actually do evaluations, which are EKG and troponins when they come to the hospital, to find out they actually have a heart attack. Same thing with women. Women, the symptoms are a little slightly different. Sometimes we call them atypical chest pains that women present with. They may feel a little belly ache, some nausea, some vomiting, some pain in the back, which is completely different from the usual I'm holding my chest and having pain symptoms. So that's the symptoms of heart attack. When you do have a heart attack, you have to automatically make your way to an emergency room. From the emergency room, or call your ambulance when they can. What happens is there's a chain of events that are initiated. If someone is having a heart attack, which are divided into several groups. One is called the NSTEMI, and the other ones are called STEMIs. They essentially stand for ST elevation MIs, which are STEMI, and non-ST elevation MIs. The ST elevation MIs are the severe ones. That means your heart is currently dying. The muscles are currently dying because blood supply is not getting to them. Because the blood supply is not getting to them, you're having an active death of your heart. So that's why it's called the MI, or myocardial infarction. When you get to call the ambulance, they tell the hospital knows to get preparation for you to have what is called coronary angiogram. And coronary angiogram looks at essentially, they go through your groin or through the wrist nowadays, and they shoot contrast into the heart to see what blood vessels are narrowed and obstructed. Once they're able to identify which ones those are, what they do is they put in stents. Stents keep those blood vessels open. Because what's happened over the course of time is cholesterol and damage from high blood pressure, damage from diabetes has lined inside the blood vessels and kind of narrowed the opening of the blood vessels, cutting out the blood supply. Once that happens, if you're able to be stabilized, they'll admit you to the hospital, monitor you, and you'll be on medications that from then on to manage your heart attack. One thing people can do on their way to the hospital or in preparation, a lot of studies have done to show to take aspirin as a kind of a prophylactic. What aspirin does, it kind of slows down the progression of clots inside your heart developing along inside the blood vessels, so the blood supply doesn't get cut off sooner than later. But the main thing you can do for yourself if you're having heart disease is controlling it, lifestyle modification. Exercising, cutting out, lowering your cholesterol, controlling your sugar, controlling your blood pressure, decreasing the amount of alcohol you consume. All of these things can help prevent a heart attack.
No, you've mentioned aspirin, and I know patients probably have aspirin in their cabinet at home. And what if, they're having a heart attack, they're thinking it's chest pain, they're considering it's a heart attack, and they have a bottle of aspirin at home. How much should they really take?
So the recommended dosing is the 81 milligram aspirin dose. If they have the 325, the one time, they could take that one. But usually as a prophylactic everyday preventative is the 81 milligram small dose of baby aspirin, they call it. But if you have a bare aspirin, if you have any type of aspirin at home, you take that 325 or the 80 milligrams and you call the emergency system.
So if they're having what is a heart attack or they're concerned about it and they only have the 81 milligram, they should only take the 81 milligram.
Yes, so the studies have shown that there's really no difference between the two of them. The 81 dosage or the 325.
So they shouldn't take like 3 or 4 to try to match up.
Because if you do that, you don't know what you have. If you have any underlying stomach issues or you have any ulcers, then you can put yourself at risk for what is called now a bleed in your stomach. So take the 81 milligram, take the one-time aspirin, and call EMS, and go to right away to the emergency room.
GTN.
GTN, yes, yep.
What about that?
GTN generally we give it to patients who are known heart attack or known heart disease, who we know that they have issues, they need to have blood vessels dilated for them to be, if patients, or just nitroglycerin that a lot of people refer to, or the nitro pills that they call it. And it's usually associated with episodes of patients have chest pain when their blood vessels are narrowing like this or they're spazzing out and doing this. And what nitroglycerin does, it dilates the blood vessel.
All right, you've heard it here, folks. If you have an underlying heart condition and you think you're experiencing a heart attack, then it's safe to take that aspirin as well as that GTN on your way to the emergency room. We're going to take a break now, and when we come back, we'll continue our discussion on heart attacks. Stay tuned.